I'm going to talk about how we can use the adapted TIST model for children in therapy sessions. And to start with, I'm just going to go back through identifying dissociation in children and just a few more things that you can look at to help you identify if a child is dissociating or not. So the first thing is that you'll be doing something in therapy if you do a more active kind of therapy, or if the child is in a play therapy session. Suddenly there'll be a behavior change, and this behavior tends to be out of nowhere. It's hard to kind of see what has happened that has triggered it. There's always a reason for it, but often it's from an implicit memory, and it might not be something that has happened in the session itself. So, for example, the one child I've given you an example about before, he triggered into shame because it turned out that he was bullying another child, and that was clearly on his mind, and he'd wanted to talk about it probably for some time, and had probably decided this was the session he was going to talk about it. But I wasn't to know that, his mum wasn't to know that. And when he triggered into shame, it wasn't directly to do with what we were talking about in the session at the time. So that's what I mean. It appears to be out of nowhere. It could also be triggered by, the clothes you're wearing that day, a particular facial expression you make. Anything could trigger it, but it's just to know it is historical. It's an implicit memory. It's often out of proportion to the situation. So that video I showed you of the teenage girl who was trashing the classroom, probably in that scenario she'd been asked to do some work. So she could have reacted to that in a number of different ways. She could have said, I don't want to do my maths and I'm just not going to do it. She could have just put her head down on the table and, just refused to work. Again, these are, I would say, out of proportion, because what a child who's regulated would do, say, I'm really struggling today. I'm not sure what to do. I need some help. I'm feeling really tired, whatever. Yeah, so the way that child reacted was out of proportion. To kind of be so angry and throwing things around the classroom is an out of proportion behavior. It's very intense. The videos I showed you with Cameron shows you how intense those emotions are. So if a child gets a bit cross or a bit angry, it's not as intense. That fight response is super intense. If a child's a little bit nervous, they'll kind of, you can see they're just a little bit nervous. It's not as intense as that flight response where they're running away, where they take cover and hide under something. And often it doesn't make sense on the surface. It's quite hard. It takes a lot of work for us as therapists to figure out what is going on. And it's impossible to reason with the child when they are dissociating into a part. So that's where we need to regulate them, and I'll talk about that in another section. And it's also ongoing. You could see with Cameron the behavior that he was demonstrating, those fight and control behaviors, they were ongoing, they were relentless, and his family was really tired. They were worn out by all of this. You can also observe the child's body for clues as to, are they dissociating? So often there'll be a change in skin color. They might go very red and flushed. They might become very pale. There might be changes in tension. So if you remember those 3 little boys in the video with the school principal, there was a lot of tension in their bodies. Yeah, so there's they might become very tense, or they might become very, much into a more submit response, where they appear to be completely relaxed and lose body tension. There might be a watchfulness in the eyes. Again, those 3 little boys, you could see the watchfulness in their eyes, and an intensity in the eyes that suddenly comes in. And that intensity, again, communicates that possibly a part has been triggered. Also working with the transference. So what emotions and thoughts are coming up and using that to guide you as to which part is triggered. So if you're starting to feel a bit cross, but you're not cross, and it's not something that the child's done that would trigger that for you, perhaps that is the child's fight part coming out. So, working with the transference is very useful. And also trying to look at what's, the underlying narrative is, what's being said between the lines. And often if you look back, and this is quite a difficult thing to do, particularly if a child's triggering intensely in your session, is just taking time out. And we have to learn that skill. It's quite an important skill to just take some time out within ourselves and go, what's going on here? So we were doing this, before that we were doing that, because sometimes the trigger was further back than we think. It might have built up because the child might have been controlling themselves, or it might be directly related to what we've just done. And when Janina talks about having that mindful awareness, we need to use that for ourselves. We need to regulate ourselves. We need to take a beat and figure it out. And even if chaos is raining around you, you can still just take a beat. And the more we're able to do that, the more regulating it is for children as well. Another thing to look for are multiple parts. So generally what I find with children is you get quite a lot of parts triggered at one time. And I hope in the previous module that was clear to you when I spoke about multiple parts coming in all together. And in the case of Cameron and Marianne, you could see the switches between parts. So those are those trigger chains where they keep switching between each other. And these are, for me, the way I understand a trigger chain is that each part is trying to protect the child. So it's like, well, that part might not be doing the best job, so the next one jumps in. That one's not doing the best job, so the next one jumps in, and so on. And they just keep jumping in so that they, hopefully are able to protect this child. A little boy I worked with talked about some parts being friends and some parts being enemies. And I really liked that. And I thought that was a lovely insight from him. So I've used it ever since I've worked with him, that some parts will collude with each other. So they work together to take control, protect the child, manage the child. So it can be any number of parts that like to come together. And it's quite useful to know if that does happen. It's a useful insight for the child. It's also a useful insight for yourself when you're working with that child. And some parts don't like each other. So it might be that when one part triggers, the other part will trigger in retaliation to that. So a child who goes into fight a lot, and I've met many children where this does happen, the shame will come afterwards because they feel bad about their behavior. So shame doesn't like fight at all. And again, it's important to know about this, to inform your therapy and to support that child. And just to be aware that this can feel very overwhelming for us as therapists, and it can feel it's definitely overwhelming for the child. When all these parts are triggering, it's very confusing. 1 minute, it's 1 nanosecond you're feeling this, the next nanosecond you're feeling something completely different. And often not even aware of why one feels this way. So that would be difficult for us to manage. It's even more difficult for a little child to manage. So we need to be aware that more than likely we are going to be working with more than one part at a time. So we need to identify and work with all the parts to process trauma in the moment. So when I talk about how we're going to regulate all the parts, you will pick which part you're going to start with. Usually I choose the last one in the trigger chain, or the most predominant part, and I'll work with that one and regulate that one. And when that one's back within the window of tolerance, I'll then go into the next part. I don't leave any parts out. It's so important that we deal with every single part, because, as I said before, if we leave one part out, that part is going to cause trouble in the future. It's not getting regulated. It's not getting the processing it needs. So it's being very aware that all parts are equal and all parts are important. I'm now going to talk or give you another little case study. So if you remember that 9-year-old boy I spoke about in module 2, his mum had said that he was different to his peers, and that boy immediately got up on his haunches, he glared at his mum, and he started growling. And what had happened is he'd interpreted her as saying that he being different was a bad thing, it wasn't a good thing, and had jumped into his fight response. So, to go through what we were talking about earlier in terms of behaviors, this was completely out of nowhere. He just suddenly changed posture and started growling. And when you look at those videos, you can see how quickly children can switch into a part. It was out of proportion. He wasn't in danger. His mum wasn't being horrible. She was really, in the session, trying to be understanding, trying to convey that she got where he was coming from. So for her, it was really confusing, because she really was very attuned, very empathetic, and suddenly she got this response from him. It was very intense. He switched from listening to being very angry. It didn't make sense, as I said earlier. She was doing her best to show that she really cared and was trying to get it. He was impossible to reason with. He just couldn't listen to us while he was in the fight part, and that's because his prefrontal cortex had switched off. And it was ongoing. The growling, the glaring, and that ready to jump up and attack body language. And this is something that this boy had struggled with at school. It would be ongoing. Sometimes he would be growling for 2 hours with no support from his teachers because they didn't know how to help him. In terms of body changes, there was no change that I could see in his skin color. So, these are just signs to look out for. It doesn't mean to say you're going to see all of these things. Changes in tension, definitely. His whole body was coiled. It was like as if he was ready to spring up and attack. And I think that's exactly what his fight part was wanting to do, and just waiting for us to show any kind of sign that we were going to hurt him in some way, and he would have attacked. Very watchful eyes. He was watching both of us and watching our reactions. And there was an intense stare. When he was making eye contact, it was unbroken. Transference, I could see he was angry. I could see he was hurt, upset. So I could feel those feelings coming from him. And the narrative, I had to play back what his mum had said in order to work out what she had said, which was triggering. And the thing that was triggering for him was her saying he was different. So that wasn't immediately evident to me when this scenario happened. It's something that I figured out by going back through the conversation we had just had.